The Coalition for Collaborative Care is a group of organisations and people who are coming together to create a better deal for people with long-term conditions.
The Coalition really is aiming to change the culture of the way health is delivered and to change the way people experience their health needs and treatment.
This new collaborative care approach is really different for the person on the receiving end. So instead of being a patient who comes in and probably has, your asthma check and your diabetes check and then your medication review, very much at the convenience of the service, this is actually getting really serious about recognising that if you're living with long-term conditions, actually you're doing most of the care, and unless you feel that you know what you're doing, that you have the skills to do what needs doing, and most importantly that you're confident in what you're going to do, it just doesn't work.
I'm very confident now that I'm doing the best thing for me because I've been pointed in the right direction. It becomes part of my life now. It didn't used to be. It used to be a worry. When am I going to get this? Or when should I take it? Or should I take it? But all these questions are answered.
For me, the learning has been this is not an optional add-on for general practice. If we want to make this work, we actually have to completely redesign the way that we deliver healthcare. So what we do is we do all the process of care, the box ticking. We feed back to the person about what their results are, which is the coloured thing on my screen that shows somebody's results letter. But that means that the space that we then have to meet with that person, have a conversation with them, is just for that conversation. We're not trying to do other bits and pieces. And we also have more time. So we have a very different type of conversation, which kind of starts with what's important to you.
And it's like talking to a mate. It's not like talking to a professional doctor or anything like that. It's just like talking to a mate.
Community groups are absolutely fundamental to what the Coalition is trying to achieve. We see again and again the power of some of the support that people with long-term conditions can access through community groups.
The Women's Health and Family Services, we run a diabetes befriending club and a patient support network. And the aims of the group is for patients who've been diagnosed with a long-term condition such as diabetes. They get referred to us from the GPs and they come for social networking. It helps with isolation, they meet friends and then sharing tips that they might have.
These activities that they provided in the club helped me to understand what I really need to, how I need to manage my weight. I mainly went there to obviously prevent diabetes and manage my weight.
The Time Bank is a charity and is based at a surgery here. What we do is we provide a community service for the GPs to refer some of the patients to us. People with long-term conditions often feel disempowered and they find it difficult to cope with what's affecting them. So what they get at Time Bank is a community very supportive and opportunities for them to, with their time, sharing their time with others, to feel involved, to participate, to feel useful. And that sense of feeling useful helps to raise people's self-esteem, self-confidence. So it helps them to manage a condition.
I've got health problems, so I've actually had to give up work recently, and I was kind of feeling that I've got sort of no purpose. What am I going to do with my life? And I started coming to the Time Bank a few months ago and making the jewellery, and I love it. And I've actually started a website and I've started selling the jewellery, and it's given me, a sort of path forward.
I think there is huge potential for the Coalition to make a really positive difference. We know that the changes required of the health system are beyond the remit of any one single organisation. We have to work together. This is about redesigning the health system for the 21st century.
What we really want to do is to support the people that are involved in delivering care in this way, and we want to help patients and carers who want their care to be delivered in this way, and we really want to make changes on the ground to put these ideas in place.